Nadra Mohammed and Ibrahim Wangara. They've been following up on these developments for us. Young person, particularly in the areas where Nadra Mohammed has visited, have suffered, died as a matter of fact, or succumbed to this meningitis situation, and we're seeking to get an understanding as to what's happening there on community issues for you this morning. Wangara is joining us via the phone lines. Ibrahim, good morning to you. I trust that you're well.
Good morning, by His grace.
We give God praise. Talk to us, Ibrahim, this morning about the meningitis situation in the Upper West region. How many of such cases have we recorded?
Yes, we have recorded 15 suspected cases, 4 confirmed, and 2 deaths. That is in the entire Upper West region. But if you look at it from a district perspective, we have Jirapa recording just a case which has been confirmed, and then unfortunately we lost that one person. And then if you come to Nadoli, Kaleo, which has a population of 84,395, that place recorded 7 suspected cases with 1 confirmed case and unfortunately 1 death. So these are the 2 places where we recorded the 2 deaths within the Upper West region. Notwithstanding, What East rather also recorded a suspected case, 1 suspected case which was later confirmed. And then we come to one municipality. Let me be quick to add the population because according to health experts, the population contributes to the cases we are recording. So if you come to one municipality, we have a population of 219,781 people. And then we are recording currently 3 suspected cases with 1 confirmed. If you come to Wa West, a population of 106,190, that place also recorded 1 case, which is not yet confirmed with 0 deaths. So these are the places so far, or the districts so far, that we are recording cases of meningitis. That is from week 1 to week 5 of 2026 as it stands. But last year, within this period, somewhere within the week 6, the region recorded 60 suspected cases with 14 deaths. That is, if you compare that to this time, the number of cases we are having, according to health people, you realize that the cases are in a way moderate, unlike we recorded in the past 1 year. So that has been the data on meningitis within the region for the first 1 to 5 weeks.
So comparatively, we're doing better as compared to last year.
Exactly so. Exactly so. However, the deaths we are recording, we asked as to why health experts will always wait for the region to record this, because this is a seasonal kind of thing where individual and all stakeholders are privy to it. We are asking to know the kind of preventive measures they are putting in place to kind of curtail the deaths. But unfortunately, we were told these deaths we are recording mostly emanate from the individuals, because most of them normally report to health facilities within the latter part of the sickness or the disease, because most of them are either quite away, far away from health facilities, and others are also not having valid national health insurance cards, which are mostly deterring them from visiting health facilities when they are even feeling symptoms of the disease. So that is mostly why these deaths are recorded. Either than that, health experts are saying that anytime they are recording suspected cases, even confirmed, it also helps them to do their work effectively. So anytime they are recording high numbers, it means that they are working and they will be able to contain the disease or the situation. But when it comes to the death aspect, that has always been a no-no to them. So they give symptoms and signs such as high-grade fever, headache, neck stiffness, photophobia, vomiting, and then in severe cases, they said confusion and then altered mental state are some of the signs and symptoms one should try to visit a nearby health facility in case you are witnessing any of these symptoms within you.
Right. And for these health experts who you've been interacting with, what is the plan for these respective communities? Yes, the numbers are not as they were last year, but in terms of sensitization, awareness creation, because from what you even tell us, you say that but for the distance between these persons and health facilities, they wouldn't have died even as a result of CSM. So are they seeking to do something? Are they going into the communities to help people understand what the issues are and what have you?
Yes. In terms of communication or public sensitization, they have issued jingles in English and other local dialects, which are being played on radios, so that as a way of informing or educating the public on what meningitis is about, the preventive measures, and then the signs and symptoms. Aside that, they are also planning to visit key stakeholders, i.e. pastors and then imams, so that they can also use their medium to talk to their followers on the importance of seeking early treatment when one is experiencing some of the symptoms. We were also told by the Upper West Regional Minister that last year, due to the plans put in place, they had resources, both medical and financially, and they were not able to spend everything last year. So what he told us is that they are reserving some of the resources they gained or they received last year during the pandemic to at least use it for the time being, So they say they are well prepared to come in as and when the needs arise. But they are also giving the chance to the various health facilities. We are told that they are able to conduct the first time, how do I refer to it? Testing of any suspected cases. So the health facilities are trained on how to conduct the first early test to confirm the situation. So when they are suspecting anybody within with their symptoms, they will now refer the person to the regional the regional hospital. We are also told that anytime a case is confirmed on an individual, whether you have health insurance or your health insurance is active or not, the region or health directorate, alongside the Ministry of Health, will take charge of the treatment cost because they think that is one of the surest way to curtail or mitigate the situation. So those people who are without active or valid health insurance that having these cases will be treated freely. So these are some of the mechanisms the health directorate is putting in place within the Upper West region.
Right. Ibrahim, thank you very much for speaking to us. And considering this is also transmitted easily, airborne as well, are we seeing the use of nose masks or something in and around the township?
For now, it's been the use of nose masks is relatively low. Though, as part of the preventive measures, we are asked to avoid overcrowded and poorly ventilated spaces. We are equally asked to practice good respiratory hygiene. That is where the nose mask come in. And also, we have to cover our mouth when coughing or sneezing. If possible, use the nose mask. We need to wash hands regularly with soap and water, as well as seek early medical treatment. So, to ensure we are able to prevent this or the transmission of this disease, these are some of the things we need to do. But as it stands now, the use of masks in the region is still low.
Ibrahim, thank you very much. That's Ibrahim Wangara. He's my colleague in the Upper West region for us. Let me go now to Saboba, to be specific, where Nadra Mohammed is stationed as well, and report of similar in Saboba as well, in the northern region, to be specific. Nadra, good morning to you. I trust that you're doing well this morning.
Yes, good morning. I'm doing very well.
Great. We've just been speaking to Wangara on the situation in the Upper West region. He's mentioned areas like Jirapa and Nadoli Kalio and the likes, where we've reported some of these suspected cases and some have been confirmed. In the northern region, I've mentioned Saboba, but have we confirmed some there? And where are the areas where we're seeing this CSM come up again?
So here in the northern region, so far it's just the Saboba enclave that we had this news, just Saboba and its surrounding communities. It hasn't spread to any other communities. I'm saying this because after the health directorate visit to Saboba, when we returned to Tamale, we made a stop at the Central Hospital, the Tamale Teaching Hospital, and other hospitals. But with all engagement with the health directorate and the nurses over there, they confirmed that so far they have not received any suspected cases yet. So for now, it's limited to only Saboba side of northern region.
And for Saboba, what are the numbers looking like?
So Saboba, unfortunately, it was two suspected cases that after a series of tests, it was confirmed that was the disease. Unfortunately, the two all died. But aside the two, there were other 9 suspected cases. Luckily, on our part, all the 9 after tests came out negative. So, but health practitioner over there told me that as it stands, they have other 5 suspected cases they are running tests on. So they are yet to confirm, after the test, they are yet to confirm whether it's negative or positive. but it's just the two that happened, and after that, there have been suspected cases, but all has been negative. We are waiting for the remaining 5 that he mentioned that they've run tests on for it to come out, and we find out whether it's going to be negative or positive.
What is the reaction of the people of Saboba to this development? 2 suspected cases, all confirmed, all dead. Are they taking extra precautions after this came out to the public?
Precaution, yes, in a way, because this is a community. They don't even know. Most of them don't even know the difference between malaria and fever. So telling them orally that this is what is happening, they don't really get the picture. So that's why they decided to do the community engagement and stakeholders engagement. So they will get to understand when it's coming from their own people. But for now, they don't really know what is going on. It's just the small education that is ongoing. That's when people are getting to know. So one of the health practitioners I engaged over there off camera told me how some of them, the health practitioners, they take opportunity of the community radio, and then once in a while they go there and then they talk to them. So some of them are getting the picture, whilst others are not getting. So they intend to continue doing this engagement and sensitization until everybody around Saboba gets to know what is happening.
You've mentioned the health directorate and the fact that they are doing community outreaches. Have some of these outreaches already started? And since so far in the respective districts in the northern region, only Saboba appears to have seen the cases confirmed it, are they taking some extra steps to trace possible contacts and what have you?
Yes, so they mentioned that aside the health directorate coming that within the district level, they had already taken some measures. They said they visited some schools, mostly where crowd is normally gathered. So they've been visiting those places, educating them, telling them on what is on the grounds. So aside the official coming, those over there knowing very well that this is the season, because one other practitioner do mention that it's not a new thing to them because of the nature of the environment, the scorching sun, and Saboba is a very dusty place due to the nature of their road. Everywhere is dusty. So it's not a new case to them. So anytime we are in this dry season, they try to educate residents on the need to prevent themselves. So they were already doing that before health directive came into the picture, and then they are now broadening the scope, not limiting it to Saboba, but other places. And yes, when they visited TTH2, they mentioned to practitioners at the Tamale Teaching Hospital to also take up the mantle so that they will educate people and sensitize them, even though it hasn't gotten to Tamale yet, but we don't know how far it will travel. So right. For now, the traces is still limited to the Saboba enclave. We don't know whether it has traveled far or is still within.
Right. Nadra, thank you. Thankfully, I've been joined as well by Arimi Yausai. He's the District Health Director of the Ghana Health Service in Saboba. I'll just speak just quick updates from him as well. Nadra, thank you very much for joining us. And then Bede Shen is here, we'll do sports. Mr. Saeed, I appreciate you joining us this morning on the 3FM Sunrise. Nadra has just been telling us about contact tracing and some efforts you're undertaking to help deal with the situation in the district. Talk to us as to what you've done and what you're doing to stem the tide. Now that we know that it's a season of CSM, and if not careful, this could spiral out of control.
Thank you very much, Mr. Eric, for having me. Yes, Saboba district has recorded a number of cases, that is 2 cases, over last month. Yes. After the first case, we have initiated our public health response system. We have reactivated it by engaging the stakeholders in the district to let them know what is happening and precautionary measures to take in order that it doesn't escalate. We have also intensified our risk communication, that is sensitization, in all the schools, the communities, the mosques and churches, to let them know the signs and symptoms of meningitis and how to prevent themselves from getting meningitis. Yes, we have also done case management training for all clinicians in the district so that they can pick up those cases early enough to prevent complications and then the undesirable results. Yes, we have done Zoom meetings, a number of them, and then physical meetings. That is the training I'm talking about. Yes, we have also made use of the local media houses in the district. You know, you are the voice for the people to help us echo our voice and to help us be able to curb the spread of the meningitis. So far, this is what we're doing in the district. And I think it's yielding a very good result because after the 2 cases we have recorded, all those suspected cases we received came reported to the facility very early and were treated and discharged without no confirmation of meningitis.
So, as at now, what is the case count? Suspected cases, confirmed cases, death, and what have you?
As at now, the confirmed cases were 2, and the suspected cases were 6. So in total, we had about 8 cases.
8 cases, suspected cases.
Suspected 6, and then confirmed 2.
And then we've seen 2 deaths as well.
Yes, it's part of the 8, please.
Right. That's part of the 8. Finally, from me, as I make way, you've mentioned activations and what have you. In other cases or in other regions, we're seeing a disparity in terms of distance for persons to be able to immediately get access to health care, which resulted in death in the Upper West region. For you in the Saboba district, are you taking some extra measures to ensure you facilitate a smooth transition from detection or suspicion to the hospital facilities for treatment to prevent possible death?
Oh, yes. Immediately after the first case, we realized that access to the major facilities, which is the CHAC hospital, the only CHAC hospital in the district, and the referral center, was a problem just because the referral system was so weak. Because you can imagine the whole district has no even a single ambulance. So we are using these tricycles, which is also completely broke down. So what we did was we engaged the district chief executive in the district to explain the situation to him, and then he assured us of putting those tricycles in shape for us to be able to use them to do our referrals. And then I also feel with the necessary agency, the government, and my boss, the DG, to kind of facilitate the completion of the Agenda 111, because as it stands now, Ghana Health Service has no district hospital in the district. The only hospital we have is the child institution, which is not enough to serve the entire district, which is about 110,000 population. So if government can come in and support the district complete the Agenda 111, it will help support the health service delivery system in the district.
So there's a need for that district hospital to be put up to help in dealing with the situation.
It's there, but it's not complete. I think the Agenda 111 started there, but it's not completed. So if it can be facilitated to support the system, to do us a good.
Right. Mr. Said, I'm positive this will not be the last time we will speak in relation to this matter. I'm sure we'll come back to you again subsequently, but I appreciate you joining us this morning.
That is no problem, sir. Thank you so much for having me, boss.
Fantastic. That's Arimi Al Said. He is the District Health Director at the Saboba District, speaking to us this morning. He will transition us very smoothly into sports because Bailey Shen is here. Yesterday I saw your